This is the Common Health Podcast, a product of the CSIS Bipartisan Alliance for Global Health Security. We engage with diverse leaders on the question of how best to navigate this period of exceptional turmoil, reform, and uncertainty in U.S. leadership. We are aided throughout by our able producer, Marla Hiller. I'm delighted today to be joined by a close friend, Dr. Jennifer Cates. Welcome, Jennifer, and thanks for coming.
Thank you for inviting me.
Jen is the Senior Vice President and Director of Global Health and HIV Policy Program at KFF, formerly known as Kaiser Family Foundation. She's been with KFF 27 years.
Approximately.
Which is amazing. That tracks fairly closely with my tenure here, which has now hit 25 years. So we have been close partners for a very, very long time. Jen and KFF are among our most esteemed and valued partners here in Washington, D.C., across a whole spectrum of things. She completed her Ph.D. at George Washington University in public policy analysis, 2 masters, one at Princeton and UMass, graduated out of Dartmouth College. And the work that she's been doing, we want to talk about where that points us. Today's day number 98 of Trump 2.0 and the revolution that's been released and set forth against global health security, humanitarian emergencies, science and the research and development enterprise in biomedical and life sciences. You've taken many of the different component elements of what we just talked about and dug in deep to try and bring forward quite detailed analyses of what exactly has happened. What were the EOs? What were the legal contestations? What were the clarifications? What have been the analyses of the impacts programmatically, organizationally, budgetarily? And that's been enormously helpful because, as we all know, this has happened on so many fronts, so fast, and at a startling pace that many people are, frankly, overwhelmed and confused by what. So the work you've done has been absolutely essential to keeping our sanity and trying to know what the hell's going on. So what I wanted to do today at the outset of our conversation is ask you to step back a bit and scan that landscape and offer us your thoughts on what are the 3 or 4 big picture meta themes that emerge out of these 98 days when you're trying to tell the story to someone about, okay, how does this all add up? So why don't we start with that question?
Sure. And thanks again for inviting me and for our partnership for all this time. When you say it like that, we've been at this for so long. We've seen actually the opposite of where we are now. We've seen when there was really very minimal U.S. engagement to growing and the creation of new things that truly made a difference. You don't always get to see that in your lifetime. And then to now see it at the other end is certainly an arc that I didn't expect. So, stepping back, it has been fast. It has been at a scale not expected. And it has been done in a way not expected. That's the Trump administration's approach to foreign aid and global health. And really its approach to government, but foreign aid in particular has kind of stood in a slightly different place, and we can talk about why. But yes, its approach has been one that in some ways I expected parts of it. I really thought this, there's going to be a big reform agenda here. Republicans in particular are not happy with the foreign aid enterprise. And this has been a longstanding building issue, et cetera. But what we have gotten between the rise in partisan politics, the anti-science, the mistrust, and the DOGE factor, which I guess it wasn't on my bingo card, meant that within a very short time, the global health infrastructure, capacity, the architecture that the U.S. has built up over time and kind of stood above most other places has been dismantled. It's not there.
Pretty much across the board.
Across the board. And it's not all gone, but a lot of it is gone. And it's gone to a point where I think, so that's one. 2, it's gone to a point where I think the global health community and those who care about this kind of work really need to start looking ahead. I don't think the rebuilding project is a realistic one.
So we're not talking about a restoration. We're not talking about a repair project.
No, I think it's really a wholesale what can be done how should it be done? What are the possibilities for the future? Hopefully with some guiding principles, right? Like one principle could be, and I don't hope this doesn't get lost, to minimize harm to people. Because it's one thing, I sit in Washington and I'm analyzing these changes, and you as well. But really, at the end of the day, this abrupt change that we've been watching is having actual impacts on people's lives. So going forward, does the U.S. want to minimize that negative impact and do as much as it can for people that really need help while it remakes and redesigns these efforts?
All right, let me just intervene for a moment, Jen. What I hear you saying is in this 98-day period, there was a very powerful political drive to enact these changes across the board with the ferocity and speed. They wanted to cripple foreign aid because ideologically they didn't believe in it, and they thought it was a remnant of a woke power or past democratic excesses and off track. They didn't have any plan for what came next. It was rather, we're just going to smoke it and move on. And now we're left with the question, what next? Is that correct?
That is correct. And one thing that, this is where the didn't expect the DOGE factor. I mean, there was a bit of a plan, right? In Project 2025, there was a plan laid out for reforming USAID and reforming State Department and diplomacy. And there were other similar kinds of approaches that were ideologically based in many cases, but were plans. They were reviews. They were changes. They were rethinking how the organization was done, but not a let's dismantle it and then decide. That was a DOGE approach that has penetrated the entire government. It just started with foreign aid. And the other thing which kind of connects too is that because the foreign aid idea, global health, is not something the American public is really going to get behind, has really ever been behind, will go interrupt town halls to tell their representatives that they're unhappy. No, they're going to go interrupt town halls to tell their representatives they're not happy with things that are affecting them directly. And we understand that. But because of that, I think they chose foreign aid in a large part because it would be easier to dismantle something that wouldn't immediately
and
have
create
a public
powerful demonstration model.
Yeah.
But we also are seeing this revolution go against Republicans themselves. It's not just against Democrats. What I mean by that is many of the people who wrote Project 2025 from the perspective of we need to reform this, were taking a much more moderate point of view about what needed to happen. They weren't saying burn it down.
Correct.
So let's take the decision on the Millennium Challenge Corporation that was a big surprise that came out last week. Say a bit about that, because that was another powerful instance of a big surprise, goes against Republican sentiment in Congress and elsewhere, goes against sentiment of many moderate Republicans who served in the first Trump administration. And how do we explain it?
MCC, to me, is an example of why this has been so hard to understand and to manage. So MCC, if we kind of think back to when it was created under the George W. Bush administration, it was motivated by dissatisfaction with the aid model and the real desire to change the dynamic between the U.S. government and other governments that, basically say, if you want our money and our support, we have all these conditions that you have to agree to around how you run your government, how you do various things. And the idea was we're going to come to an agreement, and only when we're satisfied with the terms, we will enter into this agreement with you, and it will be time limited. So it had all these elements that were at the time
partnership,
compacts, 5 years, and it was very infrastructure oriented. It was very oriented around the U.S. combating China and all of these things. And not only that, but it has over the years at different times been raised up as, why can't PEPFAR have compacts? Shouldn't there be compacts for all of the aid we do? Shouldn't we have these kinds of conditions? So everybody, including myself, thought, well, we're going to be having one of the ways forward here looks like they will be proposing some kind of MCC approach to the rest of the development portfolio. So if you want support for PEPFAR, here are the things you got to agree to. We're going to give it to you this amount of time, et cetera. Well, then on Friday, or whenever it was, we hear that the DOGE team got to MCC. MCC is an independent agency, but it is part of the foreign aid structure. So it was part of the foreign aid review. as per news reports, it's been told that it's going to stop functioning, and they're canceling, their staff are being dismissed. They're canceling the compacts with countries, which are akin to treaties almost, that have been developed and signed, like inked with the countries, are going away. And so that just leaves one wondering, what is the model that they want to have? And was some of the other things that DOGE has done after the fact, it's, oh, we didn't mean to take that down because we didn't know that that was essential for X, Y, and Z, or we didn't know that was the model. But it's happened, and it's really hard, even like as we were saying, it's really hard to put it back together again.
I mean, this suggests, the MCC decision and many of the other decisions suggest that it's not just DOGE, using DOGE as an instrument to go in and do this, to seize these institutions and dismantle them very rapidly, but it's Russ Vought. It's the White House. It's a decision taken that they really want to vanquish this sector.
Right. And it's not coming from, let's say, I mean, I don't know, haven't talked to him, but it's not coming from Secretary of State Rubio. It's not coming from Republicans on the Hill. It's probably not coming from some of the authors that we were referring to in Project 2025, but it is coming from the White House. And they have made, maybe it's a political calculation that works in some way, that it's not going to affect them politically to do this.
So do we now have a potential for a more thoughtful, planned reform process in the wake of this annihilation? The revolution's not over exactly, but these are questions that everyone's sort of looking at. Okay, where do we go from here? And if there's not going to be a restoration, then how do we begin to organize our thoughts?
Yeah, so I think there is that potential for a few reasons. It doesn't mean it will happen in a more measured way, but there's potential for that. Getting through the first 2 to 3 months of a new administration, always everyone looks to that administration. What are they doing? What's their posture? What's their policy? What are their goals? We kind of know what those are. We've seen that Republicans on the Hill have stayed back and said, we're not going to interfere at this point.
So far, Congress has been very much under the sway of the White House and not done much to stop this. But is your sense that there's going to be a power shift?
I think there's going to be a shift. Because,
and why is that?
So the president now is going to be coming out very soon, maybe even as early as this week, with some indication of his budget outline, his budget request to Congress, and rescissions. Mm-hmm. So asking the Congress, yes, you passed this budget for this year. Now I want you to, we're not going to spend it. Yeah, we're going to claw some of it back. Some of the power dynamic then will shift to them, because they can decide not to take those rescission requests up. They can decide just not to do it. It's hard to see how they're going to get total agreement on all those things. They also could decide to not meet the president where he is in his budget request. And in fact, they didn't in Trump 1. I do think the dynamic is different. But I think the fact that Congress has been unable to agree to a budget could mean that we end up with another continuing resolution for fiscal year 2026 after all this, which doesn't get us out of this conundrum, because what we're seeing is an administration that says, I don't care if Congress gave us this money, we're not going to spend it. And that's a constitutional issue. But I do think Congress is going to have a little bit more power. There's going to be budget hearings. There's going to be the need for Congress to kind of start doing what its role is. And that's when we'll see how much of is there an ability for reform? There's some inklings that may be the case. So there was a hearing on PEPFAR.
Yes.
And at that hearing, it was all about that. It wasn't a slash and burn hearing. It was, okay, PEPFAR is an important program. What do we do going forward? That was the basic premise of the hearing. And that if that continues, I think it bodes well for that project of how can we do this in a new way.
This is a big task that's in front of Congress, much bigger and different than anything they anticipated in terms of responsibility, right? The idea that Congress will become now the site of reform ideas implies that there can be more of a consensus and there can be thoughtful effort, and they can move fast enough and coherently enough in this period and in opposition in some ways to Trump, all of which, does Trump really want to hear any of this? Do they want to work collaboratively? And can Congress do anything on a bipartisan basis that's collaborative, that comes forward with ideas? Or what do you think is likely to come out of Congress in this next period?
I know that members are thinking about and working on State Department reauthorization. We don't know if that will ever see the light of day. It's going to be hard. But that is a place where some of these changes would naturally fit. And you would see that the members, particularly Republicans, would want to be responsive to the administration's directions, but also could put some guardrails in a bill like that to sort of pave the way forward for a more responsible foreign aid. I don't know if PEPFAR reauthorization is going to be a possibility somewhere, but that's another. There are vehicles where Congress can signal or even instruct its own narrative. That's one area to look to. Of course, appropriations and how Congress deals with one of the biggest challenges I think they're going to be confronted with, even if they say, we don't like this budget request, we don't want to zero this out or zero that out, or we don't want to cut the global health budget by 50%, the administration can come back and say, well, we cut all these programs. We don't need that money. You're giving us the amount of money that we used before. And that's actually probably the case. So it does say that Congress is going to have to start thinking differently about the future of this support. One question that I just put out there, and I think it could cut both ways, is the administration has been very clearly, anti-UN, not one to sort of take on the multilateral space as one to play in and wanting to go it alone. And why should we sit at the table with all these others in every realm? That's not about global health. However, there are some unique in the health space, some unique multilaterals that are different. They're not UN based. They're independent. Gavi Global Fund. They were set up to be in a way different, an antidote to the UN system, and they exist. And the Congress could think about it as if we've dismantled so much of what we were doing. Maybe the one way that we can continue to contribute is to get more money to these entities. It would certainly be different. The U.S. would not be driving all of the decisions. It speaks to a different future for the U.S. where the U.S. isn't doing implementation and isn't on the ground running programs and doesn't have staff in every country and is
doesn't
more like
have a
the
workforce.
EU. Doesn't have a workforce.
Doesn't have a grant-making workforce, but is
Right.
cutting big checks. So it's much more of a...
It's more efficient. It's financial. And they could, and the Global Fund and Gavi already have built-in ways to incentivize, but going forward, all of these instruments might need to get more transactional anyway. So I think Congress may see that as a mechanism. I don't know. I don't know if the administration would. Certainly, if there is a goal to save lives, then it's going to be hard to figure out how to do that without your own capacity.
So it's still to be determined whether PEPFAR has a long life or a short life, right? The signs are it's going to get somewhere around
half-ish,
2.9 billion, something like that.
Yeah.
About half of a little more than half of its previous levels with restrictions on it. Whether that is just an intermediate step to trying to end it all at once in the next 2 to 3 years, or whether it's on some longer pathway where there can be a more orderly transition, remains to be seen. The Global Fund, it looks like we're going to stay with Global Fund at a reduced level, but nonetheless. Gavi's sort of up in the air.
Yeah.
And of course, you've got all of this friction around vaccines so that Gavi's walking a tightrope.
Looking at these different programs, this is my comment on each of them. So first, there's a few there's family planning, it's gone. It's gone. I don't know if Congress is going to try to rectify that at all, but essentially the U.S. had been the main purchaser of family planning commodities in the world that went to support low-income women in low and middle-income countries, gone. That's just not happening. Maternal and child health, drastically cut back. Neglected tropical diseases, I don't think that's happening right now. I think that work is stopped. PMI, the President's Malaria Initiative, is technically working, but a lot of its capacity has been affected. TB, same thing. Global health security. Then you have PEPFAR, which in some ways was one of the only survivors, but at a much, much smaller way with all these restrictions. Global Fund seems like it's a survivor, although what levels, we don't know. And Gavi is a question mark. Now, the U.S. has said, and the State Department has said that in their notification to Congress, among the functions we are keeping from the USAID's global health portfolio is delivering life-saving vaccines. Well, the way that the U.S. government has done it is through two main mechanisms, Gavi and the Global Polio Eradication Initiative. That's how hasn't otherwise done it. Its maternal and child health program has been more about campaigns and supporting that work. So if it does want to, that's the way it could do it without creating something different. And so I think it's a TBD that is just a little bit caught right now in process, and we don't know. Global health security, also unclear. They have kept some aspects of global health security, and we just don't know what that's going to look like. It's not just about having a program at USAID that moves over. It's also about White House, and it's also about, we didn't talk about the CDC. So that's a whole other thing. DOGE has moved on to CDC, which has played an important role in global health.
Say a bit about what you see happening across CDC, NIH, FDA while we're on this waltz of reviewing programs and now institutions.
Right. So the HHS has been subject to this review and has instituted a pretty dramatic reduction in force of, they say 20,000 staff across the board.
Almost a quarter of their staff.
Yes. And things have been closing, task forces and all kinds of advisories. But in a practical sense, from a global health perspective, the main things that I think are going to affect the global health work is primarily what's happening at CDC. So CDC has had a Global Health Center, and that center has been funded by Congress directly to do HIV as part of PEPFAR, some TB, some maternal and child health, some global health security, polio, all that kind of work. It also is like a main partner to USAID and state in implementing especially PEPFAR. So CDC implements almost half of PEPFAR.
Right.
There was a leaked budget pass pack on HHS. So this is what OMB says to HHS, here's your budget. You can respond or take it as it is or tell us what you want. And in that leak, it basically eliminated the Global Health Center at CDC, leaving only the funding line for global health security.
So that wipes out all of the CDC work on HIV.
It would.
PEPFAR.
It seems that way. CDC already has lost staff in this Global Health Center because of the reductions in force. I think the open question is, does the administration know how much CDC was doing on the PEPFAR implementation side? And it's not clear that has come forward. And so it could get caught in a situation where even for what it wants to retain, the treatment and care, CDC actually had been doing a lot of that work. And if it cuts that out, it's really going to have an implementation challenge. It's already going to have one because of USAID being gone, but then it will lose one of the other legs of its chair. That would be pretty impactful. It's research, right? And the research enterprise, the U.S. has been the leader in global health research for decades. The innovation has come from the U.S. and U.S.-supported initiatives. Looks like the NIH will be cut by 40%. And whether that will be meted out equally or in some other way, but all aspects of research will be affected. And of course, FDA policy, primarily on the domestic side, that's where they're focused, but it will affect everything.
Let's talk a bit about the way forward. I mean, as we were talking about earlier, there's no return to the status quo ante. There's no point in saying we're going to design the restoration. We've got to begin from these new realities with some sort of sober sense of where we are, but think constructively and affirmatively looking forward and think about how to forge something that is truly bipartisan. Because if it's simply a gathering of liberal Democrats around a vision, it's not going to go anywhere. So what's your thoughts on that, on this challenge? What are some of the core priorities and core principles and values that are you feel going to motivate people to look at the future?
I think that there are a lot of Republicans in Congress, a good number who really do care about these programs, who have seen them, who've gone to the field and see the difference that they make. So they are motivated by, this is the U.S. playing a pretty pivotal role. They are motivated by that. They are motivated by concerns around China and other foreign powers that we have bigger issues with. But they also are motivated by responsible, transactional ways that the U.S. should have partnered with these countries, kind of like the MCC. But this idea that I think Congress had been getting a little fed up with what they saw, rightly or wrongly, as a blank check forever, because there were no criteria put on that.
Right.
And I think they have signaled in hearings and in language, they would be open to a different model, which is, okay, how we prioritize what we do, where we do it, and for how long we do it, and what we ask back. And I think if that becomes the conversation, there's more opportunity. It's going to be less money, probably.
It's going to be fewer countries, less money.
But also I think the hope that many have is, could it be done in a slower, more responsible way? So as these changes are being implemented, you're doing as least harm as possible. Because the U.S., the other thing we didn't say is the U.S. provides, between its bilateral programs and its contributions to multilateral health institutions, provides about 42% of international assistance for health. One country provides almost half of all of that work. By the U.S. pulling back, it's a huge hole. So it's already going to have big effects. So hopefully going forward, the focus could be on reforms and changes that, again, minimize damage, promote partnership, and figure out ways to forge this new path while not burning it anymore. We just put out a paper that we started last year and just got it out last week on graduation policies, looking at MCC, Global Fund, Gavi, IDA, and the U.S. Aid Family Planning Program, all of which have had very specific policies on how they don't give aid forever. And that's a model that the U.S. government could choose to adopt in a more meaningful way for its other programs.
How else do you think things will change? I mean, there's got to be a change in language. There's got to be a greater emphasis on private sector and there's got to be an awareness of the transactional side of this. I'm not sure what that means exactly. There has to be an awareness that China will figure that only a few countries are going to matter in this period of a reinvention of foreign aid in the initial phase. There's probably going to be a greater reluctance to pursue single disease issue perspectives. There's probably going to be more emphasis on, okay, this country matters for this moment in time, for this because of all of these other things. Let's think about an integrated approach. Might look a little bit like the transition in Eastern Europe after the fall of the Soviet Union, where the United States did a massive expansion of financing in partnership with these governments to stabilize them and move them towards the West. It lasted for a number of years, and then it was over. That might figure in the thinking as this is happening. What are your thoughts?
I think that's exactly right. I mean, there's a lot of discussion now about private sector, and it had already been happening. I mean, There had been real pushes by some to much more proactively and in a faster way adopt private sector partners and strategies and the private market in countries to mobilize internal capacity and health service delivery. So that, of course. And then there's a lot of focus on new financial model, or not new, but using different kinds of financial instruments for global health and development that have been used, but on a more limited basis. So DFC type approaches, figuring out if there's a way to kind of push the World Bank to do more of what it does, but for health, things like that. Also, the U.S. has in the last few years, and I think should feel good about this, seen a real increase in interest and motivation on the part of, particularly in sub-Saharan Africa, countries in Africa to really take on some of these challenges themselves through regional manufacturing, through regional hubs on different kinds of technologies. The U.S. could support that work in a transactional way, but in a way that's this support that we're giving you, technical, maybe some financial, will have benefits for us and you going forward, and it will be at a lower cost anyway. So I think those kind of opportunities are there. I don't know if they'll be appealing to the new administration, but they're certainly out there.
Yeah,
and it's going to happen. I mean, that organization that need to figure out ways to deal with a loss of U.S. support, but realizing that the countries themselves have to take on more and figure out their own path forward. They're going to do that. The U.S. can be there to help, or it could step back. And I think it would be a loss for the U.S. if it stepped back.
One of the conundra that we're going to face in this next period is that all of the major iconic historic endeavors by the United States, whether they were bilateral initiatives or partnerships and multilateral initiatives, stemmed ultimately from very strong leadership coming out of the White House. So there's this outstanding question of like, who's going to lead on any reform measure? Or do we need to scale down our thinking and say, okay, for the next couple of years, Congress can play a heightened role if it can figure out who's going to lead and push for things. But don't expect that you're going to have some awakening where suddenly Trump is going to be coming forward and saying, I want to be the pioneer for a new form of global health or global health security. So that, I'm not sure how to answer that question of like, where's the leadership going to come from? Because that's been an essential element of all of these. Gavi, Global Fund, PMI, the PEPFAR, the President's Emergency Plan for AIDS Relief. So how do you operate without that? And I must say also, in terms of the partners in the main countries we've worked, we've spent, $110 billion on PEPFAR, 75% or more of it in Africa. This crash has happened. How many African heads of state have expressed themselves about all of this? How many of them have flocked to the White House to say, wait a second, like in the tariff threats, say, wait a second, this is not acceptable. Let's renegotiate. You raise the specter of tariffs, you get 70 countries sending their senior leadership to bend the knee and beg for, let's get into a negotiation that avoids worse outcomes. You have a crash here on PEPFAR. Nobody showed up in Washington, which was startling. I don't quite know how to explain that either, but it reveals that on both sides, you have a gap.
And I think this was the writing that was on the wall anyway around these big initiatives that got a lot. They were driven by leadership. They were driven by focus and goals and, big pronouncements. Were from a different era. And how they survive in the new era is just going to look different. But I don't know I don't know. This leadership question is a really interesting one. Somebody could make themselves known tomorrow, but it seems unlikely. It seems that part of what's happening, too, is that these programs are not going to be seen as special. They're just going to be seen as part of a reorganization model that's trying to scale these down and maybe not play a role in this area much again. But I agree. It's hard to see who the leader of this stuff is going to be.
We ask each of our distinguished guests to close with a few thoughts about what gives you hope, what gives you optimism in this period. We know this has been a difficult conversation. It's a difficult period, but you're an optimist.
I try to be an optimist. I'd say that it's been being in Washington those last 98 days has, chipped away a little bit at that because so much has happened so quickly that as we started this, dismantled basically all the global health work.
For
everything we've always
thought.
The last
2 decades.
Yeah. But it's not about me or you. It's really about, I know that there's people suffering because of it.
Yes.
I guess what gives me hope? I think that people are resilient. And I think the people that have depended on U.S. programs, many of them will be as resilient as they possibly can. And we'll see examples of that. And that gives me hope. I also think that so a lot of the things that may happen next, if there's true efforts at reform, there could be some really good things that come out of this situation, or good things, maybe not really good, but good things. Many of the discussions around the reform ideas are important ones. And no one said that the way that everything was organized before was right. Or good or even healthy, and it needed change. Sometimes you make change by instituting reforms in a measured way. Other times you do it in a harsher way, maybe like is done in the tech industry. But that's where we are. And so I think there's opportunity to really institute some thoughtful approaches that going forward that could benefit the U.S. government, the American people, and people of other countries.
Thank you. And thanks for all of your leadership and great work. And thanks for coming here today.
Thank you.
Thank you for listening to The Common Health. If you enjoyed this podcast, please give us a follow and leave a review. To learn more about the CSIS Bipartisan Alliance for Global Health Security or listen to other CSIS podcasts, please visit csis.org.